Good morning, and today we're going to be doing the skills orientation lab. If everyone will open up their checklist book, we're going to turn to the first topic, which is how to take someone's temperature. There are 4 steps that we're going to discuss, and then we'll actually take the time out to go ahead and take temperatures. At the top of the book, it tells you the actual activity that we're going to be doing, temperature. The performance objective is below that for each topic. It says to take and record a client's body temperature at 3 locations. First in the mouth, then in the rectum, which we're not going to do today, and under the arm. The performance behavior, this is the important section here. These are the actual steps that take place in how to correctly obtain someone's temperature. And then at the bottom, there's 2 boxes. The box that says essential behavior. This is, for every activity, this box is the same. It's at the bottom of every page. It says, number 1, follows all rules of asepsis. And that is, you don't want to get the patient sick and you don't want to pick up anything that the patient has. That's basically what that means. Number 2, protects the client and self against physical harm. So you're using proper body mechanics. You're making sure that safety measures are in place. That's extremely important for every topic that we're going to cover today. We're only going to go over this one once. Number 3, takes actions to prevent or minimize emotional stress to client or significant others. And that's just maintaining someone's dignity. You know, if you were laying in bed and I was coming in to give you a bath, I just wouldn't hurry up and throw all the clothes off of you and go get a garden hose. We don't do that. So maintain that person's dignity. Ask maybe their kids, if they're in the room, you know, it's an older lady and you're going to bath her, and they have a couple sons, you know, ask them if they want to help or they want to step outside while you bath them. Because some sons, they don't want to see their mom naked. Some daughters can't bath their dads, and that's okay. But give them that option. That's maintaining their dignity. Roman numeral number 4 says explain procedure to client before initiating it. And to decrease a patient's fear, you must first tell them what you're going to do before you do it. Even if they don't respond to you, even if they don't talk, then they don't communicate. Okay, hon, we're going to go ahead and we're going to take this pillow out from underneath your left leg. And then take the pillow out from underneath the left leg. And then last, report abnormalities or changes. And that can vary from any of the body's systems. Respiratory system, any abnormalities and changes. A cough, difficulty breathing, painful breathing, bringing up sputum. What color is it? Does it have an odor? That's just respiratory. And then you have integumentary system. You know, and we have a page in class, it's the most important page in the book, it's in every patient's home, that goes over every body system and the changes that you would see that you need to report. So if you do notice something, that you are bringing it to the office attention. Okay, now, to correctly take a temperature. Number 1, prepares thermometer for taking temperature. And to prepare it, what they're saying is, first of all, you got to go get it. If you don't have one, the family may need to go down to the store and get one. Digital thermometers now, they work very well. They can be used in all 3 locations. And what you need to know is that the glass mercury thermometers, they quit making because of the mercury poisoning. Not only that, patients who are confused and normally would bite down, whenever you put something in their mouth, they would bite that mercury thermometer, and they have glass in their mouth and they have mercury in their body, and once it's in there, it never comes back out. you can't get it out with dialysis or anything. It's in there. It could cause a lot of harm, mercury poisoning. So nowadays we have the digital thermometers. There's other different kinds. There's the ones that go in the ear. They're not as accurate. I'll take a temperature with this, and it'll be 102. I take it with an ear one, and it'll say 97.7. And that's after following all the steps and procedures correctly on how to do it with an ear. I don't like them. I've let several ER doctors around Uniontown know that I don't like them whenever you take your kids in and they got a bad infection and they say, well, they're not running a fever. I said, that's wrong. Check it with one of these thermometers. And then they would, and then they'd see that there was a difference. The other thing you want to do is you want to clean this thermometer. And I've already gotten an alcohol pad out here. And I've used the alcohol pad to go ahead and wipe it off. You don't know, first of all, you don't know who used it before this person. It could have been someone in the family. Second of all, normally you use a thermometer when you're sick. So if you're sick and you put this in your mouth, the bacteria that made you sick could be on here now. So you don't want to take this and then use it on someone else or use it back on the patient again. You know, they've already had their antibiotics. You used this last week. They've already had their antibiotics. Now you want to put it back in their mouth again without cleaning it? You might get them sick again. So that's how to prepare a thermometer. Number 2, waits to take oral temperature for at least 10 minutes after the client has consumed hot or cold fluids or has smoked. And what that's saying is you want an accurate number. You don't want a number that the patient just drank some hot coffee and you take it and they're like, oh man, their temperature is 103. I better call the doctor. Well, they just had a cup of coffee. So, and it does take about 10 minutes for the temperature in your mouth to get back to normal. So that's all you have to do is wait. Number 3, correctly inserts the thermometer into designated location and leaves it in place as follows. Now, digital thermometers will beep automatically. They already have it timed. So when you push the button and you put it in, normally it's about 60 seconds. It'll beep. There's some that are faster. There's some that are slower. There's some that are really hard to hear too. Especially the older patients. You know, if they have one of these at home, they can't hear it. They have ones that light up now. Whenever they're done, they light. That way the patient they can't hear it. They lose that higher frequency of hearing as they get older. And these, they just chirp like a bird. If you were using a thermometer that was there's people still have the glass ones in their home. If you were still using one, first you'd have to shake it down, you wipe it off, then you would put it underneath their tongue. And what they're saying here, and what you need to know, is how long to leave it in. Oral would be 3 to 5 minutes. That will give you an accurate temperature. Rectal is also 3 to 5 minutes. Oral and rectal, they should be right about the same. Rectal may run just a little bit higher than an oral temperature. The most accurate temperature of all 3 is rectal. It's an actual core body temperature. And then the axilla. Axilla is underneath of the arm. You would lift the patient's arm up. You would place the thermometer where it's touching skin against skin. You would actually have to either go up underneath of their shirt, or if they had a hospital gown, pull their hospital gown down and go up underneath. And make sure that they have skin against skin whenever the thermometer is underneath of their arm. Can't do it underneath their clothes. The other thing, a lot of these older people we take care of, their nutrition is so poor that they've lost so much weight that there's a crevice up in there. It's like a hole. I would suggest taking an axillary temperature on that type of a patient, because when you put it up in there, there's a big hole. And your skin will be touching here, but nothing will be touching the tip of it. Axilla temperatures you would take on someone that was confused, couldn't follow directions, maybe they were difficult to move, to get a rectal temperature on. Maybe they couldn't move. Maybe they had something broken. Maybe they have a tumor somewhere where you couldn't roll them. cause too much pain. So there are indications where you can use Axilla. The other thing to remember about an axillary temperature is you have to add 1 degree to it when you get the final number. Let me explain. You take a mouth temperature, it's 99. You take a rectal temperature, it's 99. You take it underneath of the arm, it's going to say 98 on the same patient at the same time. So if you get underneath of the arm and it's 98, you add 1 to it, it would actually be 99. And when you go to document an axillary temperature, you put, if you get 98, you write 98, and then you put a little circle that means degrees, and then an F, Fahrenheit, and then you put AX. That tells everybody that looks at that you got this temperature underneath the arm, and when they look at it, they know, okay, I automatically have to add 1 degree to it. Okay? And number 4 is that you will correctly obtain a temperature within 0.2 of a degree Fahrenheit or 1/10 of a degree centigrade, plus or minus the examiner's reading. So we'll take a break now. Okay, next we're going to cover pulse and respiration. The objective is to measure and record a client's pulse and respiration rate. And under performance behavior, there's only 3 steps. Number 1, obtains correct pulse rate within 2 beats plus or minus of examiner's count for a radial pulse. Well, first you have to know where to find a radial pulse. So I want everyone to take 2 fingers, the first 2, index and middle finger, and at the base of the thumb, there's a little crevice there. If you go to the right, there's a knot, and if you go to the left, there's your ligament. Bones to the right, ligaments to the left. But just take your fingers. If you push too hard, you're not going to feel it. If you push too lightly, you're not going to feel it. If you push too hard, you're actually going to occlude the blood flow. You're going to stop it from pulsating like a tourniquet would, and you're not going to feel it. So it's just nice and gentle. You should feel the pulse.
I don't feel anything. Where you at? Oh, right there.
The reason that you use the first 2 fingers and that you use the pads is because that's the most sensitive part of your skin for touch. You would use the first 2. Sometimes it helps if they bend their wrists. That brings the artery a little closer to the surface.
Are you getting anything? Go over to the side a little bit more.
Okay, we'll pause because I'm going to help a couple people here.
Just use my...
Step number 2 is obtains correct respiration rate within 2 plus or minus of the examiner's count. You want to count a full breath in and then a full exhale. That's 1. In, out, that's 2. And normally what you do is you're checking their pulse. You've got your number for the pulse for 1 full minute. And then you just leave your fingers there and you quit counting the pulse and you just watch their diaphragm right in here. And you'll see it go up and down. Men belly breathe. Women, they lung breathe. So if you're checking a man right here, you'll see it go. You'll see it go up and down like this. That's how men breathe. And the women, you'll have it this way. So if you can't see it real good, here's what you do. You take your pulse and you take their hand and you lay it like against their belly. And you'll feel it. You'll see it, but you'll also feel it going up and down. You'll feel that diaphragm moving underneath of the lung area. And third, to record the pulse and respiration accurately on designated form. And we do have what's called a vital sign flow sheet where you can take the temperature, the pulse, the respiration, and the blood pressure. Some patients require that, not all of them do. We're not the skilled agency that's in there. We're there to provide private duty services, but as a home health aide to be certified, you have to at least know how to do these simple things. Okay, we're going to take a quick break here. Here we go. The normal pulse rate for an adult is 80 to 100. is 60 to 80 beats a minute. I'm sorry. 60 to 80 beats a minute. For a youth, it could be 80 to 100. For an infant, anywhere around 1 year old, it could be 100 to 120, even 130 beats a minute. So if you get someone's pulse rate and you've counted it for 1 full minute, you have to have a second hand. You start counting when it's at a certain location. It goes all the way around and goes to that location. You stop.
And times 2.
For 1 full minute, you don't multiply that. No. What you can do is check a pulse and count it for 30 seconds, and then when you're done, say you got 32 in 32 seconds, you would then multiply that by 2, and you would have the heart rate. Because you're only using half the time, you would have to multiply it by 2. If you get real good at it, you can count it for 15 seconds and multiply it by 4. If you counted a pulse rate for 15 seconds and you got 20, multiply that by 4 would be 80 beats per minute. Okay? The normal respiratory rate for an adult is 20. That's what guideline I want to give you. That's what I got. You can see it normally up to about 24. You can see a lower one down to about 16, 14. When should you be concerned about a respiratory rate? If it is 28 or higher, I've seen 32, I've seen 40, I've seen 44 a minute. And that's telling me that the person's not getting enough oxygen. There's a problem somewhere, either with their lungs or with their heart. If it goes down too low, how low is too low? And the normally accepted low is 12. If it's 12 or less, I would be concerned. I would call in. They don't want it to go under 12. There are some medications that patients take for pain that are narcotics that will drop their respiratory rate. I've seen 6, 8 breaths a minute. But they're not active, and it's because they've been medicated and their rates drop down. So anything less than 12 or greater than 24, you should call and report to the office. Heart rate for an adult, anything at 120 above, you call and report. Anything less than 60, you want to call and report. Okay? Next section is bed bath. And Stella's so graciously agreed to help us out here so that I'm not bathing a ghost. First step, well, let's look at the objective. To administer a complete bed bath to a client, conserving the client's energy as much as possible. Okay, so not only are we going to give someone a bed bath, normally if you're giving them a bed bath, they're not doing too good. They're not up walking around and they don't have a lot of energy. So for us to conserve their energy, that's very important. The other reason you would give someone a bed bath is it may be a lot safer. You know, maybe they're not helping you in transferring, and for you to have to get them up several times, it can be strenuous on your back, on your neck, on your shoulders. So there are several reasons as to why we could give someone a bed bath. The first step would be to remove the patient's clothing. We're not removing Stella's clothing. This is just for educational purposes here. But in doing so, when you would, if you're in a patient's home, you're going to be removing their clothing. What you want to do is you want to keep them covered as you remove them. Okay, there's their sheet. You would only have access to the area that you needed to work on. Okay, and what I mean by that is try to keep their modesty. So if we were helping someone off with their shirt, this one here buttons up the front. She may be able to sit up. I would actually say, okay, hon, let me help you sit up while you're in bed. So I would help her sit up, and then I could help them on and off with their shirt. Okay, you can lay back down now. If I don't tell you, Carmen will yell at me. Okay, so once we have the shirt off, then we can cover her up, and then we can get to the lower parts where we need it if the patient had slippers on, if they had socks on. Now to get someone's pants off in bed is a little bit tricky. Sometimes they can raise their butt up and you can pull it down on the sides. But most of the time they can't. You would actually have to say, okay, hon, we're going to roll over to the left here. And what I want you to do is I want you to take this arm. Oh, wait, you can't do it before I tell you. I know. So, here's what I want you to do. I want you to bend this leg up. Keep the other one straight. And I want you to push with this leg as you hold on to the rail. And then you as the home health aide, you push the shoulder and you push the knee. And it's a lot. Okay, come on back. I want to show them one more time. When you bend this leg up, and I'm going to disrobe you here for a second so they can see. You bend the leg up high. You get the shoulder and you push on the knee. They'll go right over. Just watch their nose on the bed rail.
Gently.
Yeah, nice and gentle. Okay, so if we are able to get this side down a little bit, and then, okay, hon, come on back, on your back. Now just let's straighten out your leg and relax. Try and keep them toward the middle of the bed. I would put this side rail up, go around to the other side, drop that side rail, and then do the opposite. I would lift this leg, and I would roll her this way, and then pull the other side down. It's a lot of work. It takes a lot longer, but that's the trick of the trade. And one of the most important things is your work surface. You know, I've already elevated this bed here a little bit, but if we were actually giving you a bed bath, you'd be a lot higher. That way I'm not like this the whole time, because when we get done, my back would be on fire, just from holding that position, for such a long time. Okay, clothing is all removed. Patient is nice and modest. That was what, number 3 on our Roman numerals at the bottom, central behaviors, to prevent and minimize emotional distress. That's an important part of that. Number 2, use a soap and water that is safe and comfortably warm. So, in the home you can improvise. Most patients have those pink containers that the hospital sends home for them. If your patient doesn't, what you need to do is go find a pot in the kitchen, and you can use that. You can find maybe a plastic Tupperware container. You can use that. I've never had to use a bucket before, but you could if it was clean. You know, make sure that it's clean before you use it. When you go to the sink and you get water, you want to check the water temperature first, and the best place to check it is on your wrist, just like a baby bottle, because it's very sensitive skin, and if the temperature's not just right, you're going to notice it right there. You want to make it just a little bit on the extra warm side, because by the time you get it in here, you set it down, you're starting to wash them off, it's going to start cooling pretty quickly. And nobody wants to get a cold bed bath. They want to get a warm one. Okay, and as far as the soap goes, what do they say? Dove soap is the less, there's no perfume in it, and it doesn't affect the skin. I kind of like Irish Spring, but it's all patient preferences. Everybody here probably uses a different soap, and that's fine. Number 3, washes the body parts first. I can't find the washcloth.
It's down there with your towel.
There it is. I was looking up here. Washes the body parts first, using the washcloth, face first, then the upper body. After changing the water, then the lower body, and then the genital area last. Okay, and the reason they're telling you to do it in that order is they're going cleanest to dirtiest. Now, before we do someone's face, of course we're going to take their glasses off if they have glasses on. We're going to ask them, do you want soap on your washcloth for your face, or do you just want water on your washcloth for your face? You want soap. Okay, you wouldn't do that to me though, would you? Okay, good. Yeah, because most men just use water on the face. They don't like the soap. It's pretty dry. Anybody here not use soap on their face? See? So, about half. If you include me, I'd be half. So we're going to include me. Some people do. They like it. There's actually some men that say, yeah, I want soap on my washcloth. That's fine. Just make sure you ask them first. Okay. So it says face first. We did her face. Now we're doing arms. So what we're going to do is we're going to keep her covered. And we're going to wash your right arm, hun. And what we'll do is we'll take this towel. We're going to lay it down this way. I didn't even take the tag off. And then we have our washcloth. We got a little bit of soap on it, not too much. And my suggestion for you when you're scrubbing, scrub to take their skin off. Make sure you get in between fingers. You know, there's dead skin on there. And if you don't scrub it good, that dead skin ain't coming off. And you can give someone a whole bed bath. I've went in and I've been behind someone. They gave the person the bed bath, and the patient still stunk. They still had an odor. You don't want that. So to effectively do it, make sure you're scrubbing good. You got your soapy water first. I would even suggest 2 washcloths and 2 pans. You can do it with 1, but it's a little bit more difficult. That's your soapy water. Then you have another pan here with another washcloth. This is just your rinse water. There's no soap on it. You bring it back and you scrub it again. With the rinse water, you're rinsing it off.